My name is Melanie, and I have the BRCA1 gene. And 2 weeks ago, just 2 weeks ago, I underwent prophylactic double mastectomies with Alloderm all-in-one, a nipple-sparing and skin-sparing, double mastectomies and reconstruction, just 2 weeks ago. I feel like myself. I feel great. I feel totally normal. I feel like I've already recovered, and I love how I look. I feel like I look natural, and I look like myself, only better. I am extremely grateful that we came all the way from Los Angeles, all the way here to San Antonio, Texas, to meet Dr. Crisopolo and all the people at PRMA. It's been a really, really fantastic experience. A few things I want to say about my choice to come here and work with Dr. Crisopolo. I'm going to go back in a few minutes and talk about my experience having fallopian tube cancer, but my main feeling about Dr. Crisopolo is that he's an amazing surgeon and an amazing human being. He was able to put himself in my shoes, listen super well to all my concerns, which mainly had to do with risk reduction. You know, I'm at such high risk for breast and ovarian cancer by having the BRCA1 gene that to listen to me and say, I don't want to ever go through cancer again, and be able to have me come out looking even better than I did before. I'm not going to have any visible scars. He explained to me that he would make the incisions just a smidge above where a bikini would be, because a bikini tends to ride up. And so his ability to, and then the scars would show, right? So his ability to put himself in the shoes of a woman patient and say, I want to be able to wear a bikini again someday, is just incredible to me. That's one thing. The second thing is, he explained that he would take away all the breast tissue, and if there was any doubt between cosmetic benefit, like fat, to make the breast look normal, and risk reduction, he would take it. But he would make me look normal. That's another amazing thing. Third, he explained that with the sentinel node biopsy, which I interviewed a lot of surgeons, 2 different teams of top surgeons in Los Angeles. Nobody could do this surgery. They weren't confident about it. One team said that they could try it, but they wanted to have expanders in the room just in case. And when I asked how many surgeries of this type, you know, the one-step surgery the doctor did, he didn't do any of them. Another team said that they really recommended taking a lot of lymph nodes out, but I don't have breast cancer, and I already have lymphedema in my legs from prior surgeries for fallopian tube cancer. So, you know, Dr. Crisopolo explained we could always go back in through my armpit and do a sentinel node biopsy if the pathology showed there was any cancer, which we weren't expecting, and in my case there wasn't any cancer. So I didn't want to take lymph nodes if we didn't need to, and he's the first surgeon that explained we really didn't need to do that. We could do it if we had to afterwards. That was incredible to me. He's just an incredible listener and really able to explain step by step exactly what you're going to go through, exactly what I went through. I felt like his treatment of me, the time that he spent with me to explain everything, to care for me and all my concerns, was just incredible and really unheard of in my experience. Really, really amazing. Before I decided to come here, I called him on the phone. He took a lot of time on the phone. And then I went to see 2 doctors in my home city in Los Angeles, and they actually were quite mean, and they said things like, it can't be done, you really need to have it as a 3-step procedure. And I just didn't understand that, and I felt like, why would I want to put myself through more surgery? Why would I do that? I've already gone through surgery for cancer. Now I've survived cancer. I just didn't want unnecessary surgeries. Also, some of them said that they had to do many incisions. One said they had to do the anchor incision, that's the one that goes straight down from your areola. And I really didn't want that. I didn't want to wake up every day and every time I saw myself in the mirror or looked at my own breast to feel like I went through cancer and surgery. I don't have breast cancer. Why would I want to do that to myself? So that's a whole set of things. One set of doctors said, you know, they're just selling you a bill of goods. They're just telling you what you want to hear. that really offended me, and it was at that point that I just said, I have to fly down to PRMA and actually meet Dr. Chrysopoulos in person. And when I did, he said, I'm so glad you've come because now I can draw. He drew on paper exactly the minute details of the surgery he was going to do on me. That was so helpful for me. He spent 2 hours with me answering all my questions. He's very compassionate. And then when it was time for the surgery, I felt really, really ready. So I feel like this is pioneering new ways of doing this surgery, and I'm so filled with gratitude. I can't even begin to tell you. I love the care I received. I love the way I look. I love his whole approach. Everyone I've met at PRMA has been incredible. The nurses at the hospital were great. The other thing is, when you do a search online, there are hundreds and hundreds and hundreds of women that rave about Dr. Chrysopoulos and PRMA, and that really helped me as well. When I was faced with all these doctors saying, no, it can't be done, to hear many, many women from all over the world coming here to do the surgery and feeling very, very positive about the results. That was also a turning point for me. There was a night I was crying at home with my husband, feeling like, oh, should we go? Is it true? Is he just telling me what I want to hear? And then when I read testimonial after testimonial of women saying that they had a great experience, they love how they look, they're very happy, of course, with their risk reduction. And then I met him, I just felt like, yes, this is the place for me. He's the surgeon for me. Thank you, Dr. Chrysopoulos. Thank you to all the people at PRMA. I appreciate it. One thing that I want to add about this, right? I didn't go through breast cancer, but I did go through fallopian tube cancer. So 15 years ago when I did the genetic testing for BRCA1, it was back in the early days of this genetic testing. And at the time I was 33, I was single. I didn't want to go through prophylactic surgeries at that point. I just felt like, from what I had seen my mother go through, and she's had cancer several times, from what I had seen from friends looking at their scars, I just felt like I couldn't, to be honest, my vanity couldn't handle it. And then 15 years went by, and a year ago, exactly a year ago, suddenly my CA-125 was elevated, and I had, literally from one night to the next, I had a hysterectomy, and there was a little cancer in my left fallopian tube. So I did that surgery, I did 6 rounds of chemo, my hair is just growing back now. I did second look surgery because I had not been staged, and then I had a whole bunch of lymph nodes taken out, and I'm dealing with the consequences of that surgery and just recently surviving cancer 6 months ago. At the end of all of that, I felt like, you know what? I'm 49 now. I don't mind looking a little perkier. I'm married now. My husband reassures me that he'll love me no matter what, and wants decades with me. I want to live a nice, long, happy life. I don't want to go through cancer ever again. So I'm in a different position than I was when I learned that I had the gene than I am now. So if you're a woman who's BRCA1 positive, whether you've had cancer or not, this is a superb practice to pick for your surgery. You're going to look like yourself, and your risk reduction, I went from an 85% chance of getting breast and ovarian cancer, and I just went through fallopian tube cancer, and it was hard. To go from that to a 1 to 3% risk and still look like myself with no visible scars is totally worth it to me now. So once again, I highly recommend Dr. Chrysopoulos and PRMA, and great practice, great choice. Thank you.